from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back, everybody. We're getting an update on the coronavirus this morning. You know, an airplane carrying as many as 240 Americans evacuated from the epicenter of it all, Wuhan, China, and it landed in Alaska for refueling. The CDC will screen those passengers before getting back on board and then fly to Southern California. New numbers from China to update you. The country now reporting around 6,000 confirmed cases, the death toll standing at 131. There are at least 5 confirmed cases here in the United States. And so we now ask a doctor, Baptist Health's Dr. David Gerson joining us this morning, and we're going to find out a little bit more about this virus and what you need to know about something that hopefully won't be much of an impact, but it is, of course, making news headlines because in China it is a problem that they are taking head on. They've closed down centers of travel, Wuhan, the airport we know, and then even American companies like Starbucks have closed 3,400 of their stores in China alone.
It's amazing, and when we have to put this in perspective. This can be a very serious outbreak and very serious illness. The people that are getting it in China, they have 130 people have passed away. But to put it in perspective, we've had over 8,000 deaths from the flu in our country alone. And so I can't speak for what China's doing. I will say that what we're doing, I think we're doing a pretty good job in kind of heading this off at our borders as far as where that transfer point is coming in. The big thing to take into this is like a flu virus, and there are no antibiotics for it. But you want to make sure that you're doing the precautions that you would do if someone had the flu. Make sure that you're washing your hands. Make sure that you're not going to work if you're sick or you're traveling if you're sick. The big also thing is stop touching your face, right? That's how it gets in there. It gets in through your nose, gets in through your eyes. Make sure you're washing your hands, using the sanitizer. Those are the important things. And then if you do have the symptoms, which we want you to do anyway, like the flu, headache, cough, high fever, body aches, go get to see your doctor. Now, the CDC is not even recommending that we quarantine people unless they know they've had some kind of direct contact with folks coming in from China.
Okay.
So don't be afraid to call your doctor's office, get triaged, we'll bring you in, we'll check you out.
I'm just thinking of friends I know who are co-workers like Alice and Courtney who would be so, I think alarmed by any symptom right now. And you think, oh my gosh, I've got the coronavirus. But as you were saying, it is linked. The epicenter, ground zero of this is in Wuhan, China. So without that kind of connection, it's most likely, like you said, the influenza virus, which should be treated just as with much caution, right?
Correct. And the interesting thing is, and this is what's also hopeful, in the last 48 hours, we've had that number of known cases in the U.S. has not changed. 5 cases. And all those 5 people so far, yes, they're hospitalized, but they're in stable condition and they're doing pretty well. So I think that, this is a wake-up call for us, but I think it's also a reminder, hey, we've got things here like the flu that I still have patients coming in, I'm not going to worry about it, it's not a big deal. But think about it, 8,000 cases already of deaths, 15 million people here with the flu. The headline this morning is 6,000 explosion in China. It's important. We're going to keep an eye on it, but I think we're doing overall a pretty good job in kind of keeping a tab on it.
Okay, and a reminder, folks, you still can get the flu shot. It's not like there's a deadline on it, and it will last you through the season. So go get that flu shot today if you're concerned about the influenza virus. Please do that. It will not only protect you, or could help protect you, it could help protect all the other people you see in your life and some of the most vulnerable out there like infants and our elderly. Thank you so much, Dr. Gerson, for stopping by. Appreciate you.
Perfect.
All right, there's the Baptist Health Health line, everybody. Baptist-health.com for more resources.